I think our next topic is really something that will probably generate a lot of discussion, which is the use of physician extenders in urology practices. Physician extenders, whether we're talking about nurse practitioners, physician assistants, and obviously in the academic center, residents and fellows, how these are going to be utilized. We all know that there is a current and certainly a projected shortage of urologists within the United States. We're an underserved specialty. I think the latest statistic is that we're also the second oldest surgical subspecialty behind cardiothoracic surgery. This is a very big topic of discussion amongst many of our urological associations, including the AUA, AACU, and LUGPA. And what complicates this is the variability of the roles and scope of practice that these extenders play due to different state laws. So let's talk a little bit about the role of extenders, how we're using them, whether it's going to be in the academic setting, and I guess let's start there, David. You've obviously had a vast experience having residents and fellows, and I think traditionally that's always what we thought of as extenders, but obviously now we're moving into the nurse practitioner state. Tell us a little bit about your thoughts in terms of the ever-changing role of residents, fellows, in light of the Libby Zion limited work week hour, those types of things, and how extenders are being used in the academic setting, and then we'll talk to the rest of our panelists.
There's a lot there to talk about, and there's been a lot of change, and I think a lot of change is coming forth. It wasn't that long ago, I remember the AUA did this little study and said there are too many urologists and we need to cut back on programs. And there was an accident went through, and then it wasn't very much, a few years later, discovered that probably was the wrong thing to do. And maybe it was the right thing to do because there's not an overabundance of urologists, and maybe I'm selfish and I actually like that. There's no question that with all the things going on, the urologist cannot be everywhere and do everything, and so you need some sort of an extender. And as you mentioned, we're all used to residents and fellows being extenders. And I think that whole concept of resident training is changing what they do. When I was a resident, I was on call every other night. The nights I weren't on call, I worked in the emergency room. And the stories, and it's the truth, but that doesn't happen anymore, as you well know. Was that good? I don't know. Things have changed and what they expect and their attention span on how they learn and things like that. So it's a whole complex thing. But getting to the concept of nurse practitioners and physician's assistants, many of us have had physician's assistants over the years help us, and they're great to have. I've found that our clinic, we have 4 nurse practitioners now. 3 years ago, we had 0. And what it means is, I think, we've been able to expand what we do. And a lot of the patients will say, I'd rather see the nurse practitioner than Dr. X. They spend more time with people, and after a while they become very good, and they can be very profitable. Whereas fellows, we used to be able to generate some money to get fellows from various organizations. Mark can remember in SWAG we got companies that would give money to pay for fellows, and you don't see that anymore. So you're in a difficult situation. It costs $100,000 or so to have a fellow. Where do you get that money? Whereas nurse practitioners, after they're in for a couple of years, actually pay for themselves. So I think we're going to see more and more of these people around. The question is how large practice groups, AUA, clinical urologists can be involved in their training. One thing I've found is, like, my nurse practitioner just came out of the blue with really no urological training, but in a short period of time, 6 months, I mean, she's as good as any fellow that I've had, in dealing with patients and things like that.
But that was on-the-job training that you
Right, it was on-the-job training.
I know the AUA has talked about setting up internships, if you will, for PAs and nurse practitioners, so that there doesn't have to be this on-the-job training that many of us obviously have to get involved with.